Welcome to a Shot in the Arm podcast. Day 2 of the World Health Assembly, the 28th of May. And boy, what a lot is going on today. We'll be expecting the conversations taking place at the General Assembly, the World Health Assembly, on the international health regulations, the pandemics treaty, a lot going on. And it reminded me actually of looking at a press release that the International Panel on Pandemic Preparedness, headed by the Right Honourable Helen Clark, released last night. And I thought I might actually take a moment to quote a little bit of what she had to say. New pandemic threats will not wait for papers to be signed in Geneva. Helen Clark, you are spot on. And if by any chance you are indeed listening or watching to this podcast, we'd love to have you on the show to find out more about what you think about post-COVID pandemic preparation. But on today's episode, we're going to take a look behind the headlines a little bit, because coming up on Friday in Committee B of the WHA, there will be a discussion around a new report that the WHO has produced about the rates of increases of STIs, particularly gonorrhea, syphilis, obviously the hepatitis and HIV. And, you know, I think syphilis particularly can be described as the canary in the coal mine when it comes to infectious disease, because if there's something going on there, if you see rates of infection increasing, you know you've got a problem either happening under the surface or indeed right in front of your face, but you don't have the data to and evidence to identify it. So to help us make sense of what's going on in the rates of increase in sexually transmitted infections, and indeed the report that the WHO is presenting to the World Health Assembly, I am delighted to be joined by, and I'm looking at the notes because in classic WHO style, the title of my guest is like a Charles Dickens novel in itself. Dr. Teo Wi. She's the lead sexually transmitted infections, global HIV, hepatitis and STI programs at the World Health Organization. Teo, welcome to a Shot in the Arm podcast.
Thank you so much, Ben, for having me today.
No, it's really terrific you could join us, and I really appreciate you giving us the time in what must be an incredibly busy week.
Yes,
So, the report that you all released at the end of last week, seeing dramatic increases of sexually transmitted infections. What's going on? What does the report say about that?
Thank you so much, Ben. I think if you look at the report, you will note that initially in 2020, we had about an estimate of 7 million syphilis cases. And now in 2022, which is just released now, you will note that the estimate of syphilis has gone up to 8 million. So that is an increase of almost 1 million cases of new syphilis occurring. Also, in addition to that, I think you need to know that syphilis is not the only issue here. Mm-hmm. There are different sexually transmitted infections, and there's about 324 million sexually transmitted that has been estimated by WHO, and this includes trichomonas. It also includes chlamydial infection, includes gonococcal infection, and also syphilis infection. So if you look at this, these are the bacterial infections that can be cured. But in addition to that, there are also other sexually transmitted infections. For example, you have the herpes simplex virus infection, which is commonly known as the genital herpes infection. And there's about 660 million new cases occurring every year.
Well, and
that's only for herpes.
I heard that herpes is the most searched term on the WHO website.
Of course. And then in addition to that, you know, HPV, the human papilloma virus, which causes genital warts. If you look at our current estimate, there is 1 in 3 men who have had a genital wart infection. So if you look at it, Ben, sexually transmitted infection is very common. It is also because all of us love to have sex. And that's why we have all this infection as a side effect or an outcome of a person having sex.
And normalizing sex, I know, is something that you're very passionate about, and we'll come back to it in a minute. But this seems to me, you're saying it, this is human behavior. People have sex. They get sexually transmitted infections. Why should we worry? Why should this increase worry us?
Oh, it's worrisome. Firstly, because there are many effects of an untreated sexually transmitted infection. For example, if you have an untreated gonococcal or a chlamydial infection, it causes adverse effects in pregnancy. It can cause, it can seal off your fallopian tube and you can have ectopic pregnancy. And in addition to that, your baby can have an infection such as, blindness because of conjunctivitis or also because of pneumonia from chlamydial infection. For syphilis, it's even worse because if a mother is infected with syphilis and it would infect the baby, it can even cause stillbirth. It can cause congenital syphilis if they're born with a mother having an untreated syphilis. Thirdly, this also causes infertility and also other effects of the sexual and reproductive health infections that you can also have. But also very importantly, I think, is that it increases your risk for HIV. Having herpes will have you having an increased risk of 3 to 5 times risk for HIV transmission, for example. But more importantly, HPV causes cervical cancer. It can cause anal cancer. It can also cause oral cancer. And most of all, I think having a sexually transmitted, which it also causes psychological effects, It's an issue of your partner having sexually transmitted infection causes relationship issues. It causes psychological effects that are not measurable. So there's a lot of why STIs are so important, I think, because of all these different things.
Are you seeing perhaps things going on in society that are driving these increases? Again, in the report, it was talking about the impact, say, of erectile dysfunction medications, or perhaps the role of dating apps and access to, potentially more sexual partners. You're nodding your head vigorously.
Yeah, I think the way we have sex and the way we find partners are changing over time. I think, Ben, you and I, when we were young, we find our partners when we meet them socially, we have parties and all of that. And that's how we meet our partners or things like that. But now, the social media has really given us the chance to expand the way we are meeting people. We have these dating apps. Of course, not even these young people are already using dating apps. Of all ages, people are using dating apps. And then, therefore, as a result of that, you have a better access to more casual sex. And as a result of that, then the more you have casual sex and the more multiple partners you have, then there is an increase in sexually transmitted infection. And I think one thing that you would look at it is because most sexually transmitted infections are also asymptomatic. So even if you had sex with someone, you will not know whether that person has a sexually transmitted infection. So being asymptomatic, having more partners, going to the dating app, finding more casual partners there, I think has really increased the risk of all these sexually transmitted infection rising.
So just sticking with the apps for a minute, you're saying that this is right across age groups. So it's not just young people, it's people getting into their senior years.
Of course, I know people.
But are you also seeing the apps in, we always think of them being used in countries with, very good technology, the industrialized world, but is it across the board? And are you seeing it, say, in countries in Africa as well as Southeast Asia?
I'm sure I see it in Asia because that's where I see it. I see them there. It's very common. I think it's a disclaimer. Maybe my son will be using it, for example, in the Philippines and all that. So it's very common, I think, for the apps. But although you that's where you find the partner, maybe this is also an important opportunity where you can also find the solution, the education that you need. So I'm sure that there's both ways. It's good and it's bad in a way.
I know that WHO, during the early phases of the Mpox outbreaks, had advertisements that it had placed on some of the meeting apps. And that caused some controversy with perhaps some of the member states. Was it appropriate for WHO to be doing this? Was that something that you felt you had to fight against?
I think it was very helpful. I think we did our surveys with all these new dating apps that we did. We put our communication materials on Mpox and prevention in the dating app. I think there is a little bit of a controversy, but what really mattered to us was that we involved the community, and it was really the community who utilized these dating apps and who provided the information for this dating app to really capitalize on the information related to Mpox and how to prevent Mpox. So I think WHO works with the community, and the community are the people who takes the lead in all these risk communication efforts that we have.
Could you talk a bit about diagnosis and treatment? Because many of the STIs that you're talking about actually do have effective treatments if you get diagnosed soon enough.
And I think this is an issue, and I think this is where we are really trying to work more from the WHO perspective. For the diagnosis, of course, the best way to diagnose an infection is to do it with a test. So for syphilis, you have a serologic test for syphilis, and if you're positive, then you treat based on the diagnosis. Similarly with gonorrhea and chlamydia, we now have molecular diagnostic tests that could diagnose gonococcal and chlamydial infection, and also they can be a point-of-care test. So meaning within 30 minutes, you can get your diagnosis and get treated. The big issue with the diagnosis at this point is that they are not cost-effective. They're very high cost. And most people from the low and middle-income countries could not afford to have this diagnosis. It will cost you $25, $30 to do a gonococcal chlamydial test. And of course, in high-income countries, they could afford that, but in low-middle-income countries, they don't. So in low and middle-income countries, we have what we call syndromic approach. And syndromic approach is that when you have a urethral discharge, and the most common etiology or main causative organism that causes a urethral discharge is, for example, gonorrhea and chlamydia, then syndromically, you treat for gonorrhea and for chlamydia.
And presumably the syphilis test is much more accessible, right?
Yes.
Is it WHO's view that, it sort of acts as a surrogate marker for, hey, you might want to be thinking about other bacterial infections?
Yeah, I think for syphilis, it's so important. So that's why if you are high risk, for example, it's very good to do a screening test. And you can do a screening test and see if you have syphilis. What is really very much advantageous for syphilis is now you have a dual HIV syphilis test. So you get your HIV tests together with your syphilis test for 50 cents. So that way you have more diagnosis that you can be able to do with syphilis. But we think of that, and also that's why we also need to screen pregnant women. For us, it's so critical that when all pregnant women should be screened for HIV and for syphilis. And so that's why we wanted to make sure that it is accessible for all pregnant women to have HIV syphilis tests. And that's why, if you look at it in the U.S., syphilis is increasing and congenital syphilis is increasing.
Now, congenital syphilis is when syphilis is passed from the mum to her baby.
Yes.
And we obviously know a lot about prevention of mother-to-child transmission of HIV. But could you walk us through a little bit about this congenital syphilis and therefore why providing syphilis screening to pregnant mums is so important?
So I think for syphilis, what we are recommending is that the mother should be screened for syphilis, especially in the first trimester. This is when, the mother who has syphilis can infect the baby through the placenta. And when the baby is infected during the early age of development, then you have all these different congenital abnormalities that can develop. But it is also a chance wherein it results into stillbirths or, so you have early abortions during this time. So we recommend that mothers be screened for syphilis as early as possible during the first trimester. And importantly, if they're screened, they need to be treated. And so if you are looking at it at the moment, there's a rise in congenital syphilis. It's a marker that mothers are not being screened. It's a marker that the quality of prenatal care is not as good as we should be, because you should not have stillbirths. You should not have congenital syphilis, because all mothers need to be screened for syphilis. And the big issue here is access. I think.
So as well as the US seeing increases in congenital syphilis, what other countries, what other regions are you seeing?
A lot of these countries you have seen in the US, but you also see it in African countries. A lot of other countries in the Americas also are seeing a lot of increase in congenital syphilis. So it's not just the US. You have the Latin American countries that are also seeing that increase. And of course, if you're seeing an increase of congenital syphilis, it's because, of course, you also see that there's an increase, of course, in the general population syphilis. And the mother is the end of the whole chain, right? It's, of course, started with a key population increase in the general population, and from the general population, it's the mother, and then the mother goes to the congenital syphilis. So having an increase in congenital syphilis means to say that syphilis is not being controlled overall.
On the positive side, we've had established treatments, I guess, since the 1950s, which are all antibacterial. But are you worried about the development of antimicrobial resistance in the context of STI treatment?
Yes. First of all, I think there are two things here. Let's talk about syphilis first. For syphilis, we have a very effective treatment, and that's benzathine penicillin. Give a dose of benzathine penicillin and you're cured for syphilis. The big issue at the moment is that there can also be shortage in benzathine penicillin. And this you have seen even in high-income countries.
Well, like the US.
Like in the US. And this is because the manufacturing of benzathine, it's so cheap that people don't want to manufacture benzathine penicillin anymore. They're not getting the profit they need for benzathine penicillin. So that can be an issue. The shortage is an issue as well. Where at least for syphilis, it's unlikely that you develop resistance though. So it's good that we still have benzathine penicillin as the drug for syphilis. The big issue now is for gonococcal infection. As you know, for gonorrhea, it's always a smart bug. It has always outsmarted us. It's there from the early days. Every time you introduce an antibiotic, they go around it and they become resistant to it. So now, for example, for gonococcal infection, the last line treatment for gonorrhea is ceftriaxone. And we are now seeing increasing rates of ceftriaxone resistance in countries in Asia. And you will note that some of these countries developing high level of resistance of ceftriaxone is spreading to Europe, is spreading to the US because of travel, because of tourism. People go to Asia and then they go to Europe. And so now we're seeing an emergence of ceftriaxone resistance, but we are also seeing the spread of the resistance of So in a few years' time, we really need to have an alternative treatment for gonococcal infection.
And is there anything in the pipeline, or do we need to incentivize researchers?
We have 2 now in the pipeline that are on development, and hopefully they're coming out soon. So they've just developed their clinical trials, the phase 3 clinical trials, and this is soliflodacin and gepotidacin. Both of them are good, and they have seen good treatment efficacy and effectiveness for gonococcal infection. So hopefully we'll have that in a few years' time. I hope it's going to be FDA and WHO pre-qualified in the future.
So changing tack, and now for something completely different. What about condoms? Are you seeing a reduction in condom use? And what's causing that?
Well, remember during the early days of the HIV epidemic, like in us, we are so fearful of HIV. We use condoms because that was the only solution we had. And you know that there was a real increase of condom use. All the teenagers, all the adolescents during that time were using condoms. But of course, with time, now HIV is like something that you can prevent with pre-exposure prophylaxis. It's with HIV, when you get treated, you become you cannot transmit the infection anymore. So people don't use condom, and I think it's not, the culture is not there anymore. People don't like to use condom. Although with condom, I think you can prevent of a lot of sexually transmitted infection. You see that there's an increase in STIs is an indication that there's a decrease in condom
usage. Yeah.
And that's where we're seeing where the issue is. People don't like to use condom. I think they need to invent more sensual condoms that could, that could make people use condoms again.
We're also seeing an increase in, should we say, more traditional, one might even go as far as to say reactive policymaking as it relates to sex education around the world. So are you seeing some of those more conservative movements that are opposed to condom use having an impact in countries?
I think that's the big issue here, is that when you hide talking about sex, when you're not openly looking at how you can protect yourselves, because it's so conservative, people don't use condoms and all that, then you see a bit of an increase in sexually transmitted infection, gonococcal infection, syphilis infection increase. I think when you look at that, especially in conservative cultures, I mean, if you don't talk about sex in your school where it's more professional, that's very common in European countries and all that. Even I think in our country, we talk about it in a way that it is, how do you protect yourself? But when it's hidden, you get your information somewhere else. And that can be, instead of helping the person, it can be more devastating.
Traumatic.
Traumatic in terms of looking at it in pornography and all that. So in a way, a child and an adolescent person will explore no matter where. And I think this is the big challenge for all of us, even for us parents. I mean, adolescent children will not talk about it among the parents.
I mean, they'd rather die than talk to parents
about it. And I think this is where I always say that parents should be open about it, and they should be the main source of information to their children, because they will know better how to educate their children than doing it somewhere else or finding the information somewhere else. And I think you, as parents and even teachers, they need to really be educated on how to talk about sex to your children and to your students. And that's lacking sometimes. Sexuality education needs to begin at home, and needs to begin in our educational system.
Oh, totally. I was just thinking to myself, with one big exception, my parents, who are anyway. A couple more questions before we wrap. Your colleague, Patty Garcia, wrote that of all these issues that are emerging that we've discussed, perhaps the most important is stigma. And you have a particular way of dealing with stigma, being, I think the language in some Western countries is sex positive. But how do you approach breaking the taboos of talking about sex?
When you talk about sex, you prevent sexually transmitted infection. And I think there's many things that you need to look at it in terms of whom you should be talking about sex with and how it should be taught and all these things. Of course, we're a healthcare provider. It's always so important for them to talk about sex like any other infection. I mean, you say to them, for example, when you breathe, so you get pneumonia. You eat, you get gastroenteritis. The same thing, you talk of sexually transmitted infection because you had sex, right? It's normalizing the topic of sex and sexually transmitted infection, even among healthcare providers.
So, but here you are at the WHO. You're meeting with ministers. You're meeting with health officials. How do you normalize talking about sex with them?
It's hard. I tell you, it's not that easy to talk about sex with a lot of these politicians. I mean, you need to make sure that there are policies. Sex positivity, I think, is a movement that we need to be really addressing. But to start with, I think, is really what are the practical ways to tackle stigma? I mean, this does not only happen with sexually transmitted infection. This also happens, for example, in HIV, where stigma is a very big factor. But if you look at it, stigma is even more in sexually transmitted infection rather than in an HIV-infected person. It's because you normalize it in terms of the healthcare provision that you have. You normalize it in terms of policies that are available. And I think from our perspective, if you're looking at it from a Ministry of Health and you're saying, how do you tackle stigma? You need to make sure that you have the right policies to tackle stigma from the healthcare provision aspect, from making sure that there's training related to stigma. But very importantly, I think we all have a play on what we need to be doing when it comes to a stigma. All of us needs to play a role in this. Even the media needs to be part of this. When we talk about sex, you talk about sex as if it's a taboo. The media can even have a more positivity towards just talking about sex. When you talk about sex in a more positive way, that is when you reduce the stigma. And when you reduce the stigma, you also come into play the policymaker. I think also what happens is that because of the stigma of sexually transmitted infection, STIs is not a priority. It's all that it's an interplay of many things.
You've said something there that I'm reflecting on, and I guess what you're saying is that the stigma that is associated around sexually transmitted diseases is different from the stigma faced by people living with HIV or affected by HIV. And I guess the stigma that goes with sexually transmitted diseases, and of course, in many instances, that is exactly what HIV is, that's all about, you should have protected yourself. You shouldn't have, it's a failing that you got.
You are immoral. Why did you do it? And things like that. So that's the stigma. And I don't think it's not like in HIV, you have a movement. You have this community involvement that really moved the anti-stigma, thing with HIV. For STIs, There's nothing like that. No one really is explaining why you should not be stigmatized. I wish, for example, a person like, you need more champions to talk about it. But how can you have champions when it's a fleeting thing? You have gonorrhea today, tomorrow you don't.
I'm a person living with gonorrhea.
You don't. It's not. Unless the person has a herpes infection, which can be something that is an ongoing thing. But it's the movement is not there to really try to prevent stigma. So I think the movement here, that when you look at stigma, it's about sex. You talk about sex, that it is something that's pleasurable, that having a healthy sexual life is something that you need to be achieving. It's part of your sexual well-being. It's part of your health. And that part is always forgotten. That sexual well-being. You talk about health, but you don't talk about sexual well-being.
Do you see the increases in sexually transmitted infections then as a failing of the health system? Do you see it as a failing of national and local policy? You're nodding vigorously.
I think so. If you look at those countries that have increasing sexually transmitted infection, they have reduced their budget in sexual health. They have reduced their budget on doing sexuality education, which is so critical. I mean, and also there's too much stigma about sex that you really don't talk about it like it's your sexual well-being that you're talking about, and that you would talk about sex like, oh, it's something bad. But didn't you realize that you have sex because you have pleasure, you want to express yourself? This is about expressing love and affection. So these are things that need to be part of a positive sexual education. It's not just about having a sexually transmitted infection. It's about you expressing yourself. And when you express yourself, this is what needs to be what you need to be. It's a positive thing to have sex, for example. It's because you have that affection that you need to show. It's not like you're hiding something like, don't have sex.
Yeah. So one last question for you. One last question. What do you want the World Health Assembly to do on Friday in Committee B? What is the guidance that you want them to give the WHO?
First of all, I think that's a very difficult question, Ben. But I think the first thing that they need to be doing is, of course, they need to increase their political support and their to support the control of sexually transmitted infection. First of all, I think there needs to be more positive discussion about sex. Thirdly, we need to be more open that sexually transmitted infection is part of our life and that we need to control them, and that politicians need to make sure that they need to provide budget for a sexual health services. They need to provide more support so that we can develop more tools like low-cost point-of-care tests so that we can diagnose and treat and even develop a vaccine for a sexually transmitted infection. And that we need to increase our budget for sexuality education for children. And make sure that I think we need now to make a more positive approach towards sex and have a positive messaging about how we can prevent sexually transmitted infection through sexual health and sexual positivity.
Wow. Well, Dr. Teo Wi, I think you really are a shot in the arm. This has been a fascinating and uplifting conversation, which we really need during this World Health Assembly. So thank you so much.
I think, Ben, we all have sex, right? People have sex. We just need to make sure that having sex, we are safe and we have our sexual well-being taken care of as well. Not just about our health, but our sexual well-being. We want to express our life, and one of that is through sex. Thank you so much.
Well, that's it for this episode. I feel like we've had a primer with WHO's very own Dr. Ruth. A deep, deep thanks to Dr. Teo Wi from WHO. As always, don't forget to subscribe, give us 5 stars, and you can find us wherever you download and access your podcasts. We'll be back tomorrow with another episode from the World Health Assembly. Have a great day and a safe day, everybody.